Hi everyone, welcome to episode 4 of the Enlightenment Now series, looking at Steven Pinker's book on the progress that humanity has made over the past 250 years. In the previous post, we looked at life expectancy and how across the world life expectancy has dramatically increased over the past couple of centuries. In the next chapter, Steven Pinker looks specifically at health, which he puts down as one of the major reasons why this increase in life expectancy has happened. And he kind of does a quick tour of all the breakthroughs and medical advances that we've made over this time period. Here are a few examples. So he talks about hand washing, midwifery, mosquito control, and especially the protection of drinking water through sewerage and chlorination. These things together are estimated to have saved billions of lives over the past couple of centuries. In particular, vaccines have had very obvious, measurable impacts. It's estimated that the measles vaccine has estimated to have saved 120 million lives. The smallpox vaccine, 131 million lives. Diphtheria and tetanus vaccines, 60 million lives, and other things such as penicillin have also made a huge contribution. Penicillin alone, 82 million lives have probably been saved as a result of its invention. And these are even more impressive breakthroughs when we consider what life would still be like without them going forward. So in the 20th century, smallpox, for example, killed 300 million people. So that's something that now, due to a huge global eradication program, has been all but defeated. It's a thing of the past. In the 21st century, there will be no 300 million people killed by smallpox, and in the 22nd century we can say the same thing, and so on and so on. It's not just vaccines and other kind of pharmaceutical methods such as antibiotics, antiretrovirals, deworming pills that have made a huge difference. It's also health-related ideas, so our kind of scientific understanding of health, that it's important to boil water, that it's important to wash our hands, to use latrines away from water sources, to sleep under mosquito nets. These things are largely accessible and incredibly invaluable. So all that is very well, and it's kind of uncontroversial, and is actually an amazing thing to read. It's a wonderful achievement of humanity, and these things should be celebrated. And we obviously are witnessing this right now with the global pandemic and the kind of desire there is for people to find a vaccine for COVID-19, and the huge public celebration there will be once that is discovered, and the fact that we can even say with confidence once that is discovered. So it's fantastic to read about this history, which is relatively recent history, and it's a shame, I think, that Pinker doesn't give much time to the potential consequences, but negative ones, in terms of modernity and our health. So clearly there are, the coronavirus pandemic being one, there are potential new illnesses and diseases that are created by the conditions of modernity, and that could be worse in the future. He does have a chapter later on in the book on existential threats where he deals with some of this stuff. But even in terms of not the big stuff, we can clearly look around society and see there are epidemics of obesity, of diabetes, of heart disease, of suicide, of chronic pain, of autoimmune diseases, and various other kind of relatively recent illnesses that have been created by the conditions of our modern age. And he doesn't really talk about these in much detail. I suspect what he would say is that these are bad, and he wouldn't deny that we have a very sick society. If you look around, way too sick. But what he would say is, we shouldn't be naive about this. What we should mostly be concerned about is not whether society is sick. It is. It's whether it is less sick than it was in the past. And I think, he is rightly looking around and saying, I look around society, yes, I see all these illnesses and diseases, but where is the polio? Where is the smallpox? Where is blind in trachoma? Where is measles? Where is rubella? Where's tuberculosis? Where's elephantiasis? Where's river blindness? Where's hookworm? Where's yaws and sleeping sickness? They barely exist. And that's a remarkable achievement. Yes, there are various other health issues now, but we now, those unintended consequences are inevitable, and we now have the tools to be able to solve these problems that we've created even more effectively. So that kind of counterfactual, I think, is very powerful. I think Pinker is largely right in this respect. We do now live longer and healthier lives. That doesn't mean to say that there aren't very many sick people in society, and too many, and that has even been caused by modernity itself. But nonetheless, I think it's true that on the whole, on average, people are healthier today than they were in the past. What I think is unexplored in more detail in this chapter, which I again, it's similar to the issues that we've thought about already, and I think it will continue to pop up in future episodes, is whether the progress we've made over the past 250 years will continue in the way Pinker assumes it will, or even kind of advocates that it should. So certainly we have alleviated or eliminated entirely some serious, immediate, life-threatening and debilitating diseases over the past 250 years. That's something that should be celebrated and shouted about. But does that mean that now we can focus on a broader notion of health? Now we can look, not just beyond whether we can function on a daily basis, but we can look at our social health, our relational health, our emotional, mental health. The fact that we now have the space to look at these things, does that mean that we can apply the same tools, the same procedures, and even have the same goals when it comes to this broader notion of health? So the impression I get from Pinker is he's kind of saying, look, we've already made these advances over the past couple of centuries, and we will continue to make advances of a similar ilk in the future. And we've seen, I think, we got quite good evidence of what this attitude does when applied to areas of health that maybe don't work so well. So we've seen, for example, that the medicalization of various mental disorders can have backfire effects. It's not always the best treatment for someone who has a sense of meaningless or emptiness in their life to just give them a pill or some other relatively crude or short-term psychiatric treatment that doesn't get to the kind of heart or depth of the issue. We are witnessing this kind of medicalization of what you might call spiritual lives that can potentially reduce these issues to short-term symptoms, and in fact quite adequately deal with something like depression, for example, on a surface level for a very long time, while on a deeper level not actually getting to the heart of the condition. And I think in general this is there doesn't seem to be a distinction in anything Pinker says between almost the kind of low-hanging fruit of progress and scientific understanding when it comes to improving our lives, like eradicating various infectious diseases, and the potential things that are completely out of our reach, like existential issues such as whether we have hope or despair, whether we have a sense of meaning or a sense of emptiness. These are things that may never go away, and it's not a matter of using all our scientific understanding and best efforts to learn how to live without them. It may be that we actually need to learn how to live with them in order to live well. And our efforts, if we just continue the same sort of methods, these enlightenment methods of reason and science and progress, to these much deeper problems, these much deeper issues of existence, that actually in the long term our efforts will make things worse rather than better. So can we apply the sort of progress we have witnessed that Pinker does a very good job to outline in terms of people's health, that we've seen over the past 250 years, to a broader notion of health? I suspect that we can continue making wonderful progress, but I also suspect that we will not always do things for the better. So I'll leave you with that. Next episode we're going to be looking at sustenance, and we will continue this roller coaster tour of humanity's progress of the past 250 years. Thanks for listening.